Good evening, everyone. Good evening, all our partners and friends on Facebook. This is Dr. Aquilas Ricks coming to you on our Zoom feed. I'm the founder and president of AfriH, African for the Restoration of Ethics in Government. We are a nonpartisan organization designed to harness the expertise of professional Africans in the diaspora and around the world to discuss issues of importance concerning Africa and her future, and how we can inspire future generations in public service. Today, I'm excited to welcome to our table of dialogue, Dr. John McCarthy. Dr. McCarthy is a professional African. Actually, he's from Liberia, where I'm from, and he's based in Canada. He's based in Canada. Dr. McCarthy, welcome to AfriH.
Thank you, Dr. Rex.
I'm just going to give just a little brief background about you, and then we can just have some conversation tonight. Can we do that?
Yes, let's go ahead and do that.
Great, great, great. Well, you have a professional background that spanned over 15 years, with 4 years in the federal departments and one Crown Corporation of the Core Public Administration of Canada. Your work includes coordinating and leading strategic operational planning, performance measurement, audit and evaluation, risk management, policy analysis and development. And the list is so long, I can go on and on and on. It would take all my time, but it's lengthy what you are doing. Currently, you are an advisor on strategic planning, performance management, and reporting with the Public Health Agency in Canada. Your educational achievement, you hold a PhD and a Master of Philosophy in Public Policy and Administration from Walden University. You have an MPA from Carleton University in Canada and a BSc with honors from the University of Science and Technology in Ghana. You also have a length of certificates in public management, project management, administrative regulation, managing in the public service, audit and evaluation, emergency management, gender-based analysis, and it goes on. It goes on. We are pleased and honored to have you to just grace our platform with your presence as we discuss issues concerning Africa. Welcome again. So can we dive in?
We can dive in.
Wonderful, wonderful. You know, last week I did a monologue that I called Public Policy 101. And in that monologue, I kind of went into an overview of public policy and the implications of policies. And I want to bring it in so we can kind of build from that. We can have a discussion based on that monologue that I had. So to all our viewers, you know, this is not an official interview with Dr. McCarthy. That will come another time because I intend to have him here where we can talk more specifically on things that he has done and how that can apply in the African context. But tonight, he and I are going to have a discussion and a dialogue concerning policy. You know, Dr. McCarthy, for me, policy, you know, in a layman term, is simply a position statement. It's a position statement, you know, and everyone have policies. It's amazing how we don't even think about it, but some people don't allow people to smoke in their cars. You know, that's your policy, you know. Some people don't allow you to wear shoes in their home, you know, that's a policy. I want for you to just speak along those lines concerning policy. I mean, what's your view on policies? What is it?
Well, all of my academic and professional life has been in policy. More or less has been an international public servant. So policy, formulation of policy development and policy analysis, these are processes I've been involved with, not just academic knowledge, but professional wise. With the government of Ghana, with the government of Canada. Policy, simply put, are laws or rules adopted by various levels of government. It can be central, which is federal. It can be state or province. It can be municipal governments. Well, those rules and laws are adopted as a way of providing certain kind of specific services to the public. And there's what we refer to as a policy sector. Policy just don't evolve in a vacuum. There has to be stages through which policy comes about, either is intended to provide or give a service that that policymakers think there's a need, or it may come about because of some crisis, such as what we are seeing today in Eastern Europe. Some policy can be adapted just to respond to that immediately. The policy process is a guided process. It's not an intuitive process. It's a scientific process that requires systematic steps that need to be taken by policymakers and ensure that certain results are achieved.
Thank you so much. Thank you so much. Now, let's look at the process of policies, because for our training, I mean, as public administrators and policies students, you know, we understand that policy, not just, as you mentioned, not just generating a vacuum. You know, there's a research process that comes with it, you know, and then you go into the actual formation of the policy and then implementation, you know, and evaluation. As you look at the process of policies, okay, again, within the African context, because AfriH exists to help African governments understand these things. As you look at in the context of the African governmental sector, which of these areas you think is the most challenging for our people?
I think all stages of the policy process is a challenge in Africa. I had an opportunity of working in Africa, not just in the Canadian public service. One thing is lacking is that we lack policy professionals in Africa. It's because we have not focused on providing the knowledge and skills we need. You know, you have schools you have people who do political science, economics, and stuff like that. But you need trained policy professionals that understand the policy process, that understands that you need to identify what the issues are. And not just identifying the issues, we should understand that you need to conduct some research. And the research is to ensure that the policy that's been developed is based on evidence. It's not intuitive. Besides the research that is done, you need professionals that understand that we need to have different options and not just one option. Because you cannot address an issue with just one option. Because if that option is not working, what's the next option we can possibly lean on to ensure that we achieve the results that we anticipate over time? There has to be some consultation, and consultation process is a complex process that involves various layers of actors and stakeholders. So you need people who have the knowledge and training to be able to do that. Unlike Africa, where we don't have those kind of structure, those kind of arrangements. In the developed world, those arrangements are there in terms of ensuring that those who work in policy shops get training over time to ensure that it's sharpening their skills, so that in 5 years, you have professionals working in the policy shop that understands the process. I think we lack that, and possibly this kind of forum could provide some feedback. The universities and policymakers can consider how best capacity could be developed in the area of policy development over time.
You know, I concur when you mentioned we need policy professionals. I think one of the things that I mentioned last week was that there's a need for policy analysts, you know, which is, you know, in line with what you're talking about, policy professionals we need in the governmental sector to really to help, you know, guide governments from the conception of policy through the implementation. But I want us now I want you to just elaborate a little bit on implementation. Because your background, your expertise have been more of putting feet to policies, you know, making things happen, you know, implementing these policies. But again, let's help Africa. Let's help our brothers and sisters understand the significance of implementation. Talk about that for us, Dr. McCarthy.
Implementation against a challenge. It's not an intuitive process, as I said earlier. You need to build in several variables. You need a governance structure for implementation. Who's responsible at the highest level? Who's to account at the highest level? You know, senior management, mid-management, and even program officers. Along the chain of implementation, who's responsible for reporting back to ensure that that policy is working. right? So that's another thing we lack in Africa. And my whole observation has been sometimes, for example, you have government official or government functionaries being called to the Senate or House of Representatives, incrementally to report. That not be the case. If you have the deputy minister who's responsible for that, that should be built into the implementation process. Whereas if it has been done quarterly or by semi-annually, where some report has to be provided as to how that program or that policy is being implemented. That way, decision makers at the highest level understand if there are some policy failures, and if some action needs to be taken to make sure that the desired results or the planned results is on course. I don't see that happen in Africa.
Well, that if we struggle with forming good policies, in fact, let me ask you this question before I talk about evaluation. Share your take on what constitutes good policies or bad, and what constitutes bad policies in your view.
A good policy, in my view, is simply put, let me just give a simple definition of policy. I said law or rules. That may be a bit complicated, but the simplest way to define policy is action or inaction of government. Every action of government is policy. If government decide not to act, it's also a policy as well. Can you just restate the question again, Dr. Rex?
About good and bad policies.
Good and bad policy. Good policy is a policy that ensures that all stakeholders are involved in formulating and delivering that policy. And what I mean is that along the policy process, you have stakeholders, you have interest groups. It should not just be left to the policy makers to formulate policy and implement them. And the reason is that in public administration, we have what we call a social construction. Policy makers develop policy because they think that certain groups deserve more than others. And most often than not, some groups benefit more than others. So to ensure that there is a balance, there's a need for interest group, for think tanks, such as this platform, and those who feel that they will be directly affected or more affected by the policy to get involved in the process. So that the final outcome of that policy is, it might go a long way to meet the needs of a broad spectrum of the population, instead of it just being one-sided. So that's one way we can have a good policy. A bad policy is that leaving it just to few policy makers or decision makers in government to craft something that don't meet the need. For instance, if it's healthcare, you sit back and they are going to formulate a healthcare policy that says that, well, there should be user fees for the government-run healthcare. But meanwhile, majority of the population are working, and majority cannot afford the use of fees. And that policy goes through the Senate and gets approved. Who gets affected most? The most vulnerable get affected. The rich don't care, how that policy got designed because they have the means. So those are bad policies that just do not work. And that's the reason why we see in Africa, people cannot afford basic services because they don't have the means to access them. It should be structured in a way that, rich and poor can equally access it. And one of those social areas are education and healthcare. It should be accessible to all regardless of your status.
Wow, well said, well said. I want you now to talk, to chat with us about evaluation. When you think about implementation is one thing, but after a policy is implemented, okay, what's the importance of evaluating what had just happened? because for me, I believe evaluation is so critical for future generations. It's so critical because when you evaluate something, you get a broad picture of the pros and cons. What you did wrong, what are some of the gaps, that happened in this whole implementation thing that caused a delay, or and how you can close those gaps for future, future policies. So chat a little bit, briefly concerning the importance of evaluation after a policy has been implemented.
Evaluation has to be embedded in implementation. It should be clearly stated timelines and how the process of evaluation is going to take place. And the reason why we conduct evaluation, especially in government institutions, is to assess the value for money, to assess our investment. If, for instance, we invested, say, $20 million to build 5 hospitals over time, for instance, we want to know if, our projection for the results we intend to achieve was achieved or not. If the money was used, was properly managed, and that's what we talk about value for money. We talk about effectiveness, and we talk about efficiency. So evaluation is intended for decision makers to sit back and say, well, the money we invested, did we achieve the results or not? Should we continue with this program or should we discontinue? What were the issues? What went wrong? What worked and what did not work? So that's the essence of evaluation. But evaluation don't take place at the end of the project line. It is embedded in implementation, and incrementally evaluation takes place. And one way we evaluate is that quarterly or yearly we do a report on how far we have come with this program. Are we achieving the results? If not, what are the challenges and how do we achieve those challenges? What are the risks we have faced for the first year of the project life? And if there are no risks, if the project is on close, then we know that the initial plan of that program is progressing as planned. And then at a higher level, those responsible for accountability can report back to Parliament or back to the Senate or whoever they have to report to that, the investment, the budgetary allocation for this program, is progressing as planned. So that's the underlying reason for evaluation, because if you don't evaluate, you don't find what has been achieved. You cannot make recommendation as to how to improve or to discontinue that project approach.
Thank you so much. Well said. Well said. Well said. You know what? We have one question for you from one of our listeners here. And the question is, how can the citizens of Africa participate in the decision-making process?
Yeah, as I said initially, the decision-making is just like the policy process or the planning process. You have interest groups. Sometimes you have individuals who have interests in a given policy. Instead of just sitting by, it's high time that African citizens get involved in this process. These things happen in the developed world. So much so that sometimes some of these policies get challenged in court. When people feel that it's not going to benefit the broad majority of the population. When these policy processes are going their consultation, it's a good idea that individuals and groups, civil society, think tanks get involved to influence how that policy gets shaped, so that people at the bottom of the economic ladder can equally benefit as compared to the rich. But that's something that is lacking, something I've not seen. We have civil society, for instance, in Ghana, for instance, in Liberia, where the involvement in policy on health, education, agriculture is basically lacking. And because of that, policies are being formulated that is not moving the country ahead at all.
Wow. It's amazing how when you start this thing, time goes so fast. We are pretty much at our end of our little segment here, but I want to say this to our listeners out there. You will see Dr. McCarthy again. You will see him again. So we'll have him again to go in a little bit more detail concerning other areas of expertise that he has. Dr. McCarthy, I want to thank you again for your time, for being here with us. Just want to ask you any concluding thought that you have. Maybe people back home, who will be watching this feed, may have questions, or maybe there's someone, interested in going into, public policy, public administration, just what concluding thought you want to share or you want to give them before we conclude tonight?
A concluding thought, as I said initially, universities and government institutions need to start considering how best they could design programs to impart knowledge, to build policy professionals to work. You don't go to this department and see, a senior policy analyst. You don't have these professionals as is done in the US and other developed countries. We need that. Maybe we need a policy school at the University of Liberia that train people not just in political science, but in public policy. They have a school of public administration, but I think they also need to embed in that some specialization in public policy. That way, over time, we have enough policy professionals who are not just second guessing themselves, but they have the expert knowledge to be able to formulate policy based on the resources they receive for their department's work. Besides that, within the department itself, there is a need for capacity building. And they can rely on professionals, international professionals, if they don't have the capacity at home to build those skills at one time. Allocate part of that budget to just to go towards training. That way, in 5 years, you can have junior analysts all the way to senior analysts who understand the policy process, the reporting process, the implementation, the evaluation, all of those variables that comes together to ensure that the policy, we have a very good policy being developed for the government of Liberia or any African governments speak. Evaluation is also key. There is no way you put in millions of dollars into a project and there is no assessment to determine if the outcome was what we anticipated or what has been. It means that you are just pumping cash into a black hole with no results to determine if there's some lesson that could be learned that could be applied to similar projects elsewhere, from education to healthcare. So I think it's a good idea that we always sit back as African professionals and look at where the gaps are and try to fill those gaps. Knowledge transfer.
Well, thank you so much, Dr. McCarthy. Well said. Ladies and gentlemen, this is Dr. John McCarthy, a PhD, also a master's in philosophy of public policy and administration. He's residing in Canada, working in city government there in Canada, and it's a pleasure to have him with us this evening. Dr. McCarthy, thanks again for your time. I really look forward to have you again. And as I said earlier, we're going to be kind of make you one of our regular contributors to our program here, because you have so much wealth of knowledge to share with future generations and to inspire current leadership in government. Folks, I want to thank you again for joining us. This is Dr. Aquilus Ricks. This is AfriH, African for the Restoration of Ethics in Government. And we want to leave you with our motto, doing better by doing right. Africa can do better if she simply does right. Have a good night, everybody. Thank you for your time.
Thank you.